If you've been dealing with any health challenge for more than a month, I don't care what it is, this video is a must watch because one of the most important systems in your body is almost certainly being ignored by your doctor. And without addressing it, healing becomes exponentially harder. Now, that system is your nervous system. Here's what most people don't realize: you have an autonomic nervous system, and it operates completely outside of your conscious control. So, you don't tell your heart to beat. You don't tell your gut to digest. You don't decide when to release cortisol to regulate your blood pressure. Your autonomic nervous system handles all of it silently, constantly, without you ever thinking about it once. It is the master controller and the regulator of every organ, gland, and tissue in your body. And if you've been dealing with a health challenge, whether that's a thyroid condition, a gut issue, a hormonal imbalance, chronic pain, fatigue, or anxiety, there's a very good chance that not only is your body under stress, but that stress is being recorded in your nervous system. So, day after day, month after month, and when the nervous system accumulates too much stress, it stops adapting, it stops regulating. The organs, the glands, the tissues that it controls become chaotic. It becomes dysregulated, unable to heal the way that they're designed to. And this is why true healing goes beyond the organ or the gland that's impacted. It has to include the nervous system that controls it. Here's something that your doctors almost never told you, and it may be the single most important thing you can do to support your recovery, is that your nervous system has been keeping the score. Every argument, every night of bad sleep, every time you lie awake at 3 a.m. with your heart pounding and with your mind spinning, every symptom that hit you and that fear then flooded your body, it's been recording all of it. And here's the part that changes everything, is that your body doesn't know the difference between a real threat and a thought about one. The moment that your brain registers danger, real or imagined, your physiology responds the same way. Your heart rate spikes, your digestion starts to shut down, your cortisol floods into your bloodstream. But what if I told you there's a measurable number, a single biomarker that tells you exactly how stressed your nervous system really is, and that there's a precise, research-backed technique that can actually retrain it? And that's what this video is about. So stay with me, because the science behind this will completely change how you understand why you feel the way that you do. Before I get into the technique, I need to show you something about how your nervous system gets conditioned in the first place, because without understanding that, the solution won't make sense. And it starts with a dog. And most of you have heard of the Russian physiologist Ivan Pavlov, who was studying digestion of animals, of dogs. But he noticed something that changed neuroscience forever. And what he had found is that he was able to ring a bell before feeding his dogs, and they'd salivate. After enough repetitions, the bell alone, with no food, made the dog salivate. So therefore, he had a neutral stimulus that had been permanently wired to trigger an automatic biological response. There was no thought required, no decision. It was pure autonomic conditioning. Now, here's where this becomes deeply personal. You and I are Pavlov's dogs. And think about someone who had a panic attack in a car. The first time it happened, it was terrifying. Their heart was pounding, their chest was tight, they were dizzy, they convinced that something was seriously wrong. Their nervous system logged that experience as a threat. Now, when they are just approaching a car, before they even open the door, before they even consciously even think about it, their blood pressure starts to climb. Their heart rate jumps, their palms become sweaty, and they hadn't even thought about the danger of the car or the experience that they had. Their body was already responding. And now that's not psychology, that's biology. And it's autonomic conditioning. The same mechanism that Pavlov documented now operates inside a human nervous system. And it gets even more clinically important than that. If you've lived with chronic digestive issues like IBS, bloating, and cramping, or every time that you feel a symptom, your nervous system is then going to become triggered, and it's going to register that as a threat signal. So over time, your body begins to pre-activate the stress response before the symptom even fully arrives. The anticipation alone becomes a trigger. The nervous system has been conditioned to fire. And that same thing can happen with chronic pain, with chronic fatigue, with anxiety. that seems to come out of nowhere. The body's not broken, it's been trained by an accumulated experience to respond this way. And here's what nobody's telling you is that this conditioning operates completely beneath the conscious awareness. You can think all the positive thoughts that you want, but if your nervous system is conditioned, it fires. And this is why mindset work alone isn't enough. This is why talk therapy, while extremely valuable, often hits a ceiling, is that you cannot think your way out of an autonomic response. You have to retrain the system doing the responding. So how do you actually do that? That's where HRV comes in. Now, in a few moments, I'm going to give you the exact protocol, the precise timing, the research behind it, the apps to use. But first, you need to understand what HRV actually measures because most people are tracking it without knowing what it's really telling them. A lot of you have an Apple Watch or some type of device or wearable that's probably telling your HRV. Now, HRV stands for heart rate variability, or HRV. It's not your heart rate. Your heart rate tells you how many times your heart beats per minute. HRV measures something a bit more detailed. It's the variation and the time between each heartbeat. Here's why that matters. A healthy, resilient nervous system has a heart that beats somewhat irregularly. The intervals between each beat fluctuate. So that variation reflects the autonomic nervous system constantly adapting and balancing and regulating in real time. So therefore, what we find is that a high HRV means that your nervous system is flexible, that it's responsive and resilient. In order to get these types of gaps, as you can see on this slide, you need to have activated both your sympathetic nervous system, or as we're going to call the SNS, and your PNS, or the parasympathetic nervous system. So I want you to think of it like a gas pedal and your brake pedal. If you have the gas pedal down to the floor, that's your SNS, your sympathetic nervous system, and you're going to go fast as your car can go. And there'll be very little deviation in its speed. If you're going from point A to point B at 60 miles an hour, it's going to take you 1 hour to go 60 miles. But if you're pushing the brakes and then the gas, you'll have lots of variation in that time frame of which it'll take you to drive 60 miles. And so that's going to indicate to us that both of your systems, your parasympathetic nervous system and your sympathetic nervous system, are both functioning. They're both putting on the gas and the brakes, and that's what we want to see is to create that proper balance in our systems. Now, with this autonomic nervous system, one of the things that we're going to see is that this is the part of your nervous system that controls your automatic functions without your conscious thought or awareness. And when your sympathetic nervous system is activated, the SNS, the gas pedal, you're going to have your eyes are going to dilate. You're going to have increased heart rate to promote more blood flow to your tissues and organs in response to the threat. Your lungs are going to dilate and bring more oxygen in so that you can, again, be prepared to fight or flee. It's going to also release more glucose so that you have more energy available. You're going to have a reduced motility of your intestines. Your bowels are going to be less active because you're not wanting to have a bowel movement in that moment when you're, again, fighting or fleeing. It's going to also inhibit your digestion. So your stomach and those functions of your digestion will slow or even sometimes stop. It will also stimulate the adrenal glands to release hormones that are going to help you in this fight or flight. It's going to also activate stress regions of your brain, which is going to cause you to have more hypervigilance. It can also cause issues when you're more sympathetic dominant, to have troubles with your memory long term. Now, your parasympathetic nervous system, when it becomes activated, it's going to cause your pupils to constrict. It's going to slow your heartbeat. It's going to cause your lungs to constrict, the bronchi of the lungs, because you don't need as much oxygen. And so it's more in the recovery stage. It's also going to enable bile release from your gallbladder. So it's going to allow your gallbladder to release bile to help with digestion. It's going to stimulate certain hormones that are going to help your digestion. It's going to increase motility of your intestines. It's going to cause your bladder to constrict. So a lot of times when your parasympathetic gets activated, as we're going to learn here in a moment, you're going to feel the urge to have to go to the bathroom, to urinate. You're going to have releases acetylcholine in the brain, which can actually counteract some of the stress hormones in your brain. So it can cause your brain to become more relaxed and less vigilant and less hyperactive. And when your sympathetic nervous system is the one that is in control of the majority of the time, that's when we're going to see that you're going to have a lower HRV. And so lower HRV, or what we like to say is when your nervous system becomes dysregulated, one of the first things that you're going to see is they're going to have fatigue because you're constantly using up extra energy in that nervous system. Your nervous system uses 25% of your energy, but is only 4% of your body weight. So it's aggressive on how much energy and resources it uses. Over time, with that chronic activation, it can lead to anxiety, overwhelm, and rumination. It can lead to sleep disruptions where you have troubles falling asleep, or you wake up at 2 or 3 o'clock at night and unable to fall back asleep. You're going to have gut dysfunction, brain fog, memory problems. You're going to have heart palpitations potentially. You're going to have hormonal issues because when you affect one hormone, you affect all the hormones. So if you're having more epinephrine and cortisol and adrenaline, those are going to impact your sex hormones, your estrogens, your testosterone, your progesterones. It's going to cause you to have chronic muscle tension and pain. It's going to also lead to more numbness and tingling sensations, as well as it can cause your immune system to start to break down. One thing that's not on the slide that I think is also important to recognize is that one of the things that can happen when you're in sympathetic dominance is some people are prone to becoming what they call their nervous systems are going to become sensitized, where they're going to feel more of their bodily sensations. So for example, right now, what I mean by that is if you're sitting in a chair and you're watching this, now, if you think about it, you can feel your butt bones. But when our bodies become, and when some people's bodies become sympathetic dominant, they start to feel more sensation. So it can increase the amount that they feel pain or discomfort, and it can make the pain more intolerable. And so they're learning now with a lot of the research that's coming out is how we can regulate our nervous systems to actually help desensitize somebody that has become sensitized. A lower HRV is also associated with increased inflammation levels and HSCRP levels. A lot of my patients know about that. Impaired gut function has been associated with lower HRV scores. They're also seeing where people have significantly elevated cardiovascular risk with a lower HRV. The research papers on this is not subtle though, and it spans decades and thousands of papers. And here's the clinical reality that I see constantly is that patients in their 40s and 50s who come to me feeling exhausted, wired and tired, anxious for no apparent reason, with gut issues that won't resolve, hormones that are dysregulated, and simply who just don't feel well, almost universally have a nervous system that is dysregulated and simply stuck in that threat mode. And no supplement, no hormone protocol, no dietary changes are going to fully work until we address that foundation. And when someone's nervous system is stuck in that dysregulated state, the state of the body starts to drive the state of the mind. And now the body and the nervous system have become the primary driver. And this is one reason why people start making poor decisions that go against what they want, because their bodies are now running the show. Their bodies are wanting relief from this chronic activated state. So we're going to start to turn to alcohol. We're going to turn to foods. We're going to turn to escapism through shopping or TV or whatever it is so that we don't have to feel this dysregulated state. So in order to stop the chaos, we have to sometimes sit with our nervous systems and with our hearts. And we have to recondition them to feel the peace, the safety, and the clarity. And it starts with improving your HRV. And so how do you do that? Well, here's the foundation. First and one of the most important things you can do to improve your HRV is to exercise. And especially cardio has been shown in the research to really help improve HRV metrics. Now, I also want to put a warning note on this. If you're already thin, if you're already wired, and you're already kind of running through life, sometimes running can actually make the problem worse. So in some patients' cases, we may not recommend that they start doing cardiovascular training out of the gate. It just really depends case by case, scenario by scenario. Sleep quality is extremely important. If you have a bad night of sleep or a broken night of sleep, your HRV will plummet. If you are eating unhealthy, sugary, refined foods that cause your blood sugars to go up and down, it's going to hurt your HRV. So eat clean, real food. Drink half your body weight in ounces of water per day. One of the things I like to do is I like to add a little bit of sea salt to every one of my drinks so that I make sure that I get the minerals and electrolytes that I need. You also want to make sure that you monitor for negative, fearful thoughts and beliefs. What are some of the thoughts that you have on a regular basis? And this is where therapy comes in, where we can find cognitive distortions that we have that may not be based in truth anymore. Once again, this can happen because our bodies have triggered our minds to be hypervigilant, and then we start looking for and finding reasons of why we might not feel well, but also because of some of our beliefs, our long-term held beliefs that we've had as children. For example, if you believe that dogs are dangerous, every time you walk by a dog, you're going to have a stress response. If you believe that life is a scary, dangerous place, or that your health is ruining your life and that you are held captive to your situation, or that you absolutely hate work, then those are going to bring down your HRV on a daily basis. Another thing to check for is the internal pressures that we have. If you're constantly on, if you're driven or unable to relax, even when nothing's wrong or nothing's going on, that reveals that there's a lack of safety in your body. And it can also mean that you're capturing a baseline sympathetic tone. So sometimes a driven individual sometimes needs to find that they need to relax. And then one of my favorite quotes from Joseph Dispenza says that your personal reality is often a reflection of your personality. And so, in one of the journeys I've had to make improving my HRV, I had to realize I was a driven individual, and that drive was actually not really good for my nervous system. So I had to learn how to activate drive and unactivate my drive to find that balance. We also know that yoga, stretching, massage, and chiropractic have all been shown to improve HRV levels. Meditation has been shown to improve HRV. Also, we have to look for improving our biological stressors. And oftentimes these are the hidden stresses that are happening in people's bodies. Things like autoimmune diseases, nutrient deficiencies, inflammation. If they have too much weight, their hormones could be imbalanced. If they have gut issues or leaky gut or a lack of good bacteria, these can all impact the nervous system and the HRV. So that might be worth evaluating with a functional medicine provider if you don't already have one. You also want to avoid stimulants. Caffeine, certain medications can actually cause your body to have a lower HRV. And now, in order to activate your parasympathetic nervous system, one of the best ways is through resonance breathing. But before I explain how this works, you need to understand the nerve that makes it possible, and that's the vagus nerve. Now, the vagus nerve is the longest nerve in your body. It runs from your brainstem all the way through your neck, into your chest, down through your abdomen, connecting your brain directly to your heart, your lungs, your gut, and your immune system. It is the primary highway of your parasympathetic nervous system. So when your vagal tone is high, your body's going to be able to shift out of stress and then into recovery. When your vagal tone is low, which happens after months and years of chronic stress, your body loses its ability to down-regulate, to press that brake, and it gets stuck in that survival mode. Now, here's what makes the vagus nerve remarkable, is that 80% of the fibers in the vagus nerve are afferent, meaning that they carry information from your body up to your brain, not the other way around. So your gut, your heart, your lungs are constantly sending signals upward, shaping your brain's perception of safety and danger. This is why chronic gut issues can drive anxiety in some people. This is why chronic pain can amplify somebody's fear. This is your body talking to the brain constantly. Now, if those signals say danger, the brain responds adequately. Now, here's where resonance breathing comes in. When you inhale, your heart rate naturally speeds up, and when you exhale, it slows down. This is called respiratory sinus arrhythmia, and it's your vagus nerve modulating your heart in real time. Resonance breathing is typically 5 to 6 breaths per minute, and it amplifies this effect dramatically by synchronizing your breath with the natural oscillations of your cardiovascular system or your heart. And it's approximately 0.1 hertz. When those two rhythms lock together, your baroflex sensitivity increases, your vagal tone goes up, and your heart rate variability reaches its maximum amplitude. Now, you're driving the parasympathetic nervous system through the vagus nerve with every single breath cycle. And it's not by accident, but it's by design. And this is why frequency matters. It's not just slow breathing. It's breathing at a precise rhythm that resonates with your cardiovascular system the way a tuning fork resonates with a specific note. And that synchronization is what produces the lasting training effect on your nervous system over time. And this is where the science gets precise, and I want to be very specific with you because not all breathing techniques do the same thing. Now, researchers have discovered something remarkable about the cardiovascular system. It has a natural oscillation frequency. your heart rate, your blood pressure, and those baroreceptor sensitivity cycles all together. And that cycle operates at approximately zero point 0.1 hertz, which corresponds roughly to, like we mentioned earlier, 5 to 6 breath cycles per minute. When you breathe at that exact frequency, and I mean that frequency, your breath rhythms are going to synchronize with the cardiovascular oscillations. And the result is a maximum amplitude in your HRV. You are mechanically activating your vagus nerve with every single breath. And this is called resonance frequency breathing. And the peer-reviewed research is amongst the most robust in the mind-body medicine for this specific topic. So there are multiple randomized controlled trials that have shown that 8 weeks, the consistent practice produces, actually, let me go to that slide. And what you'll see if you're hitting resonance breathing is that your oscillations, your heart rate will go up higher and then go down lower as the brakes are being applied. So what you're looking for, if you look at the slide, is when you have a low HRV, you're going to have low oscillations where your heart rate doesn't go up as high or down as low with each breath. But as you find that sweet spot, you're going to find that these oscillations become larger and larger. And that's what you're looking for, because the larger the oscillations, typically the higher the HRV is. And there are multiple randomized controlled trials now that have shown that 8 weeks of consistent practice can improve your resting HRV. They found that it can reduce anxiety scores, that it can reduce your cortisol levels. It can improve your sleep quality, drop your blood pressure. It can even, for some patients, has shown that it's reduced their PTSD severity. And critically, what the research shows is that resonance breathing reduces conditioned fear responses. So as we mentioned earlier with the person having panic attacks whenever they went near a car, they found that when they learned to control their nervous system, the reactivity of their nervous system, that they were able to uncondition the nervous system from having a fear response. So that's just like with the Pavlov's dogs, that when you rang the bell, they would salivate. Well, this training unconditions the dog from salivating when you ring a bell if you do it properly and long enough so that your body can become unconditioned. So the great thing is, what I hear from my patients is that the coworker that used to stress them out doesn't stress them out anymore. Or the Sunday scaries where you're stressed out on a Sunday evening before you go to work. Patients report that they don't have that anymore. And what's great is it literally diminishes the automatic reactivity that gets triggered by those learned associations. So you're not just calming down, you're reconditioning the nervous system. And that's what's great is I've heard from my patients is that they've gotten over certain phobias or those little annoyances of fear that come flooding their system. Those just disappear or get diminished. And it's great when I hear from a patient that they're just enjoying life much more because their systems are much more calm and regulated. So here's the exact protocol that you will need to implement when trying to do resonance breathing. Now, typically, it's suggested that we start out at 6 breaths a minute. So that would be, in this case, a 4-second inhale and a 6-second exhale. We want the exhale to be a bit longer because that's where the brakes are being applied. And now some of you might be different. The taller you are, the bigger your lung capacity, that could change what your needs are. So in that case, some people might need to breathe even less. Some people breathe 4.5, 5 per minute. It just really depends finding that resonance level. And that's something you can research further, not for today's purpose. But the important thing is that it's smooth and continuous breathing. You're not holding, you're not pausing. You're not forcing your breath. You're doing it from your diaphragm. That's very important to note, that you're not using the top of your lungs. So if you put your hand on your chest and on your belly, and when you breathe in and your hand goes up, you're activating these muscles that activate your chest to breathe, the accessory muscles here, and you don't want to do that. You want to activate your belly, your diaphragm. The diaphragm is going to open up and make your belly purse out. So you want your belly to open up. As that opens, you're filling it up like a balloon. And then as the balloon gets full, you let the pressure of the balloon breathe the air out very lightly, not forced. So nothing in this is forced, nothing is stressed, nothing is being held. That's the important part. So it's really a calm breath. It should be a silent process. You can do it with your eyes open or eyes closed. In a moment, we're going to talk about some certain apps that you can use to help you with the breathing rhythm. But the important part here, again, is that you're not activating your muscles. It's very relaxed. There's no forcing, no effort, because we're trying to get your parasympathetic nervous system involved. So if you're trying too hard, then it's not going to work. Another problem too, I see it oftentimes, is people take too much of an inhale. So they're taking too much air in and then they get lightheaded or get dizzy. It's about 50% of what you can take in and about 50% of what you can exhale. So it's keeping things at the very light level. The next thing is the research is showing that twice a day, 20 minutes a day. So I do mine first thing in the morning. When I wake up, I get a decaf coffee. I go downstairs. I turn on my UV light. I then do a 2-minute readiness check to see where my nervous system's at for the day. I then will do 20 minutes straight of resonance breathing. In the afternoon, I do it right before lunch. You typically want to do your readings before you eat, because once you eat, it's going to cause some extra stress in your system. So we want to get a clear visual of what's in your body. One of the things I have to be honest with you, though, is I do 20 minutes for the morning, 15 minutes for the afternoon, and that seems to work great for me. Now, one of the other things that you can use also to do this is you can use an app. Elite HRV has an app where you can track your breathing rate, and you can change that breathing rate based on what you think yours is to get to that resonance breathing. Now, one note with that too is I also use a polar heart rate strap. They have an H9 or an H10. They both work well with the Elite. And you can use those tools to see what's actually happening. On HRV Elite app, you can actually go to a screen where it just shows you the breathing. I do suggest that at first because you can kind of get caught up with watching your heart rate go up and down. You're like, mine's not going up and down, and that can cause stress for some of you, or you're trying to get it to go too big and then you're trying too hard. And so you can kind of fluctuate between using just the metronome, where you can see where it tells you and guides you how to breathe, or you can have it where it shows you the heart rate rhythms and the fluctuations in your heart rate as well. And you can kind of play with it to see which works best for you. Now, I also want you to understand this is that I want you to think of this as strength training. You would never go to the gym and say, I can't bench press 300 pounds. I can't believe it. And then quit because you didn't do it. The reality is it takes years and years of training to improve your strength and stamina enough to bench press 300 pounds. You're not going to necessarily feel different with HRV training. Some people report that they do. They'll start to notice as they're breathing that they're more relaxed. Some people will report that they're less reactive or they sleep better. But the reality is that most people don't feel much of a change. They don't feel a change because the changes happen so slightly and so gently over time that they don't see the changes that are happening in their body. They'll reflect back and realize, like, I'd realize that I'm not as reactive to this, or this doesn't make me as stressed as it used to be, or I'm having less awakenings now, or when I do wake up, I fall back asleep easier, or I'm not having that weird random heart palpitations in the middle of the night while I'm watching TV. Just little changes will start happening over time. So it's nothing that's drastic. It's a cumulative change that happens over time. So please don't look for immediate gratification. That's just not what's going to happen. And realistically, that's not really what happens with many health protocols, is that we're always looking for the instantaneous gratification. But the reality is that there's going to be ups and downs, even when you start training, even when you start doing new healthy behaviors, is we don't see a straight linear progression. It's always with its ups and downs. But over time, if we commit ourselves to the process, is when we see the change. Your nervous system has been conditioned by years of stress, symptoms, and fear responses. And that conditioning is real. It's biological, and it shows up in your HRV number. And the good news is that it's trainable. And the research is very clear. And the protocol is simple. And unlike most interventions, there are no side effects, there is no prescriptions, and hardly any cost. And this is the foundation of everything that you live your life through. It's how you live, it's how you breathe, it's how you interact with life, is through this nervous system. And it's time to take care of it. So if you want to go deeper on nervous system regulation, gut-brain connection, and the functional medicine approach to root cause health, subscribe to our channel, because every few weeks I'm putting out content that your conventional doctor either doesn't know or doesn't have the time to tell you. And if you've been dealing with fatigue, anxiety, gut issues, or hormonal chaos, a link is in the description where you can learn more, or you can schedule an in-person or virtual consultation from almost anywhere in the United States. And now, until next time, get well and stay well.